So welcome and thank you for joining us today. My name is Ashley Calderon. I am the Clinical Implementation Manager for the AIM CCI project. We are here in Anacostia at the Family Arts Museum for a roundtable to discuss the AIM CCI project, the Community Care Initiative, and talk today about bundle development and what makes our process unique and innovative. I am a nurse. I worked in maternal child health care for my entire career, and I really came to this work because I believe that when you walk into someone's life and have the opportunity to provide care to them, it really is a privilege. You don't know what they are bringing to the table with their experiences, and likewise, you're bringing your own lived experiences in there. And you have that opportunity to gain their trust and to make a difference in their life. And I hope that AIM CCI can bridge those gaps and encourage people to first look within themselves and then look at the system to see how they can make a change in their own community. So we can start by going around and telling about how the work that we do with AIM CCI. Deidre?
Great. Hi, I'm Denise McDaniel. I'm a maternal child health social worker, and I'm also the clinical community bundle integration specialist here at AIM CCI. The reason why I'm working on this project and what brought me to this work in general is because I have a deep desire to make an impact in the disparities in maternal health outcomes for African American women. Sana?
Sure, thank you. Hi, my name is Sana Sultana. I'm the data manager for the AIM CCI program. My role involves supporting the team in gathering data and evidence to support bundle implementation and even bundle development. The reason why I'm here is because of my interest in understanding maternal child health, but also researching and being able to support the development of measures and metrics in bundle implementation or even improving general outcomes for mothers and birthing persons across the country. I'll pass it on to Sue. Thank you.
Hi, I'm Sue Pendig. I'm a women's health nurse practitioner and attorney and work with the AIM Community Care Initiative as a clinical community integration and patient safety strategist. I've worked in maternal and child health and community health for my entire career, and this project brings together both of those spheres perfectly in the hopes that we can truly make a difference in improving outcomes for families and to eliminate the disparities in maternal health outcomes. And I'm going to ask Lidibes to introduce herself.
Thank you, Sue. Hi, my name is Lidibes Sawyer, and I'm the Equity Implementation Strategist. What brings me to this work is both my personal and professional experience. Professionally, my work has always been grounded in equity. It has been an evolution to be in this space of maternal child health, and I hope that the work that I do within this space allows us to instill and inculcate equity.
All right, so now that we've talked about who we are and why we're here, I guess we need to do a little bit of background and just talk about first, what is a bundle? So Sue, would you like to get us started with the conversation and discuss what a bundle actually is?
Sure. A bundle is simply a small set of evidence-based elements that, when they are performed consistently, help to improve outcomes. And in maternal and child health and obstetric care, we're used to seeing bundles in the hospital setting. So, for example, what do we do if a woman is hemorrhaging during labor and delivery? By implementing a small set of steps consistently, people can find the medications that they need. They can act quickly in that situation to help save lives. The thing that's interesting about AIM CCI, and what I think is really exciting, is we are moving that process into the community. And by moving it into the community, we need to understand what is happening in communities that are placing the lives of birthing persons at risk. And we need to go to the community to really help to understand that and understand the realities of their lives and what is driving some of the risk factors. So one of the things AIM CCI did was a survey of sites that are working with us to help figure out what some of those root causes in the community might be that we can address through bundles in AIM CCI. And Sani, I think you were working on the survey. Can you talk us through some of the things we found from the survey?
Yes. So part of what we did with AIM CCI was conduct a survey with all of our constituents, both individuals within the local maternal safety work group as well as the national maternal safety work group. committee, I'm sorry. And part of that process involved obtaining qualitative and quantitative data. And we juxtapose that same data with the publications that are provided by the CDC or even other researchers across the country. And that information aided us in tailoring and understanding what the communities needed and how we can be able to create bundles that are actionable in real time, and also that we can be able to obtain data that can be able to inform some of the work, both in the short, intermediate, and long term. So it is definitely a continuous process of learning. Now, these evidence that we compile from researchers and even publications have aided us in creating a set of recommendations that we continuously review, we continuously evaluate. And as we move along, we are learning a lot from what the community needs versus what we thought they needed in the initial process. So it's definitely a continuous process, and we continue to learn from these processes.
So it definitely sounds like it's a collaborative effort in terms of pairing the evidence and what we're seeing in the data and the literature and what's going on in the outcomes, but also infusing the information that we're receiving from the community to make sure that we're addressing the needs, we're addressing what the data has, and it is evidence-based, but it's also participatory from the community aspect.
Absolutely. So the data we obtain, or even the measures that we develop, go directly back to the communities, and the communities aid in understanding what is plausible, what is feasible, what is even collectible. And that aids us in, I think, understanding where we go next, hopefully in next bundle development as we move along the program.